The very things that were put in place to reduce the infectious impact of the virus resulted in taking away from people certain protective factors which were very important for people's health. As we all know, for us to be mentally healthy, for us to be psychologically healthy, we need to interact with people. We need to be with people at least some of the time, interact with people, talk with them, etc. And the pandemic led to us being socially isolated, quarantined, not being able to meet people, all of which then took away this particular social protective factor that most of us had, which protected us from developing psychological or mental health problems. Things that did not help with social media. I mean, there are good things about social media and there are not so good things about social media. As we all know, lots of news got spread over social media when there were lockdowns, when the pandemic was raging. It led to a lot of confusion, it led to a lot of fears amongst people, it led to a lot of irrational behaviors, as you might have seen or experienced or read about in the papers, which again lead to a lot of stress and affects people's mental health. Obviously, this was going to lead to effects on people's mental health. We had immediate impacts on people's health, which happened immediately as soon as some of these things were put in place, the social isolation, quarantining, etc. And there were other things that happened and will continue to happen over a longer period of time. So what were the immediate impacts that we saw? We saw that there was an increase in symptoms of mental health distress. The prevalence or the proportion of people with mental health problems increased, especially depression and suicide. We also saw that some of the actions that were taken to mitigate COVID-19, such as social isolation, etc., led to increase in mental health problems. Substance use increased. I mean, alcohol, although there were lockdowns and shops which were selling alcohol closed down, we know that people were able to still access alcohol, and the fact that people were not working, people were stressed, meant that the amount of alcohol that was being consumed went up. Domestic violence went up, as I said. Packing people into their little homes for long periods of time leads to frustration, and so that was another increased risk factor, especially for women who were already experiencing domestic violence. There was heightened increase or risk of developing new mental health problems. While people with existing mental health problems got worse, there were people who did not have mental health problems before the pandemic who started developing mental health problems. And finally, people's access to mental health services reduced because people could not travel, people could not go and see their psychiatrist, psychologist, psychiatric social worker, or for that matter, any kind of health services unless you had COVID, which meant that a lot of people who were on treatment, who were receiving counseling, etc., especially in the initial few months before telemedicine came into its own, were deprived of appropriate services for the mental health problems that they were experiencing. Then there was this specific case of grief. I mean, we know that there were lots and lots of deaths that happened, especially during the waves that were happening in India and other parts of the world. Lots of people lost their loved ones and hence went through the grieving process. Now, unfortunately, because of the situation related to the pandemic, people did not get opportunity to go through the normal grieving process which all of us go through when someone we love passes away, and this process allows us to heal. So because of the pandemic and the restrictions that were put in place by the pandemic, as in only a few members of the family, if at all, could go and kind of pay their final respects to the person who had passed away, the natural and the cultural rituals that we have as a part of our grieving process that we do, which would not happen because of the pandemic. All of those things were taken away from us, and that did not allow people to go through their normal grieving process. And as we know, that normal grieving process is a part of psychological closure and a way of saying goodbye to the person that we love, and which allows us to heal, and not having that led to an increase in the adverse impacts that can happen because of that. And we know from evidence that the grief that followed from COVID-19 deaths for people who were left behind was more intense than following deaths of people due to other causes. We know that there was increased level of grief. We know that there was significant impairment of people's ability to function if they were experiencing grief from the COVID-19, and also people were also experiencing more severe syndromic conditions such as post-traumatic stress disorder. But that's all research, and that's all numbers, and we know that numbers don't tell us everything. Behind the numbers are stories of real people, which some of you must have heard about or read about and must have seen on social media. There are stories of real people and how it affected real people. So for example, you had stories of multiple people from the same family dying over a short period of time. We know of children who were orphaned because of the pandemic, with both of their parents passing away, no one to take care of them. We have heard stories about a pregnant dentist who took all the precautions that she could in her professional life while she was kind of seeing her patients, but then contracted COVID-19 from someone at home and died from that. And while she was in hospital, she kind of recorded a video while she was dying, telling people to take COVID-19 very, very seriously, but because many people were not taking it seriously. We have the stories of a young mother on a ventilator support who was listening to a movie, a song from a movie which was kind of telling her how to enjoy life a few days before she died. We know the story of an 8-month pregnant government school teacher who caught the virus while she was on election duty. We know the story of a journalist who got COVID-19, needed to get into a bed in hospital and be on a ventilator, could not get the bed, and live tweeted his attempts to get a bed, and kind of was in reality kind of live tweeting his final moments in the world on Twitter. So these are some of the heartbreaking stories that came from the pandemic behind all of those numbers, because numbers don't move all of us. There are stories of people which move us and tell us how devastating the pandemic, especially the second wave, was, and how it must have affected people's mental health and will continue to do so. And what is particularly different about the pandemic-related grief is it had both primary and secondary losses, right? So primary loss is when you lose or someone that you love dies. Secondary losses are losses that happen because of that person passing away. So for example, let's say there was someone I cared for and that person passes away. That's my primary loss. But by that person passing away, I am losing my function as a caregiver. Now that's also a loss. That's a secondary loss, right? So for that example, if my child passes away, then the child passing away is a primary loss. But my parenting or my role as a parent, I lose that as well. That's a secondary loss, and that has impact on people as well. People had multiple losses, many people within the family dying. These losses were stigmatized, which brings with it its own stress, right? When people from the family died with COVID-19, the whole family was stigmatized by the neighbors, relatives, other people in the community, etc., which brings with it its own level of stress. Disenfranchised grief because we were not allowed to go ahead with all of the cultural and community related rituals that happen with grief. We lost the right to do that, and that kind of complicated the grief. And finally, the anticipatory grief. I mean, worrying about losing someone when someone was in the ICU, was unwell with COVID, and you were knowing that they were dying. Preparing for their death is anticipatory grief, and many of us had to go through all of this. And finally, the stigma, especially for health professionals who are working day in and day out to help people with COVID-19, the stigma that they had to experience, communities trying or housing call these people from housing societies, telling them to stay away, stay only in the hospitals, not to come back home, etc., was an additional stress that people experience. So all of these things that I spoke about were the immediate impacts on people's mental health due to the pandemic. On top of that, we are seeing now and will continue to see for many years to come the long-term impacts of the pandemic. And that's going to be the next pandemic, which has already started. I mean, it's the virus is one pandemic, but the mental health effects of it is going to be another pandemic. And this is because a lot of negative impacts that have happened on people's lives in terms of social determinants, things that lead up to mental health problems. People have lost their jobs, people have become poorer. All of these things are going to have long-term impacts on people's lives. We know that there's going to be increase in anxiety, depression, and other trauma-related conditions. We know that people being exposed to a range of social risk factors and decreased access to community and reduced access to mental health services are going to lead to exacerbation of their existing mental health problems on a longer term basis, as well as development of new mental health problems on a longer term basis, along with substance use disorders, including alcohol use, heavy alcohol use, which has other long term effects. Looking at children, children have not been immune to the effects of mental health as well, of the pandemic as well, and there are several reasons for them. I'll look at a very specific reason why the mental health of young kids or children have been affected. The key reason being schools. Schools closing down. Schools play a very, very important role in young people's lives. They do different things for different people. But I mean, besides the academic benefits, which we all know, if you go to school, if you get educated, there are the academic benefits, but there are various other things. They help in young people developing their social skills. They help them to build resilience. They help them to build up their social networks, learn from their experiences. It helps them to protect them from risk-taking behaviors and like substance use. If you are out of school and on the streets, you're more likely to use substances as compared to being in school. For many young people from poor parts of the society, being in school means that they are not a part of the exploitative labor system. If they don't go to school, they are made to work for money. Now that's exploitative, so being in school is protective for them. Being in school for many people, especially young people from the lower socioeconomic strata, allows them to have good nutritious food as a part of the midday meal. Being out of the school meant that many children were not able to do that. And finally, being in school and their interactions with the teachers, peers, as well as school counselors, where they have school counselors, allows schools to function as a gatekeeping institution where there can be early detection of any psychological or emotional problems that children may develop, and then provide appropriate care. So closure of schools took away all of these protective functions from young people's lives, leading to increased mental health problems. So one piece of work done by the UNICEF showed that the prevalence of depression and anxiety was extremely high. This was done during the pandemic in young people, especially in young women. So you might turn around and say, what I'm talking about here is only problems, and more problems. And what's the good news? I'm not here to kind of tell you that the world is full of problems and there's nothing that we can do about it. There's certainly a lot of things that we can do about it, and that's why we are sitting here today. That's why we do all the work that we do, because we believe that we can make change by working both with individuals as well as with health systems. So I will look at the larger picture very briefly, because this is about resilience. I'll not spend a lot of time on the larger picture, which is health systems and what we can do about health systems. I'm going to spend a lot more time on individual level resilience. So what we can do at the kind of the health systems level is a lot of things. We can empower communities to take care of other people within the communities. We need to address social determinants which lead to mental health problems, things such as employment, poverty, etc., because those are upstream factors that can along the way downstream lead to mental health problems. We can build strategic coalitions with various other network players such as NGOs, etc., to strengthen our health systems. We can recognize the diversity of resources within our communities. And what do I mean by that? For example, within the Tibetan community, I mean, one of the key strengths that you have is the Buddhist culture and meditation and mindfulness. I think that's an important resource that you have within your community, which you have to be able to leverage along with your work that you are doing in Western psychology to build people's strengths and help people with mental health problems. So we have to look at this diversity of resources rather than focusing only on limited things that we can do with what we have. But that's at the systems level. Because we are talking about resilience, let's just focus on what we can do at an individual level. All this while I have been talking about mental health problems, I want to look at the other end or the other side of the coin, because the two sides of the coin are mental health and mental ill health. We can talk about deficits or weaknesses or mental health problems or risk factors, or we can talk about good mental health, resilience, strengths as the other side of the coin, because they all lie on the same spectrum. On the one hand, we have mental well-being, at the other end, we have mental illness. What we do in most part of our work is to look at the risk factors, the deficits, the illnesses, and work on those, but we neglect, to our disadvantage, the other end of the spectrum that we should be working on, which is prevention of mental health problems, promotion of good mental health, and building up of strengths and resilience amongst ourselves so that we do not develop mental health problems, or we reduce the impact of mental health problems if we develop them. And which is very interesting, because when it comes to physical health, we are very good at taking care of ourselves. We are good at exercising, taking appropriate diet. We do all of these things when it comes to physical health. But when it comes to mental health, we are not so good at doing all of the things that we should be doing to build our strengths, to build our resilience, and to reduce the chances of developing mental health problems. But before we do all of that, we have to first remember that life is not always going to be hunky-dory. All of us know that there are ups and downs in life. We are always going to go through bad phases in our life. There's absolutely no person in this world, and I'll be happy to buy you dinner if you can tell me at least one person in this world, except maybe the Dalai Lama, who will tell has always been happy. But I'm sure he will also tell you that he has had difficulties in his life. So there is not a single person in this world who will have not gone through some difficulties in their life. So it's not about ensuring that we don't have any difficulties in our life. It's about building resilience, i.e. building up our strengths so that we have, through a longer period of time as a process, so that we are able to build our resilience, to take care of ourselves when we have difficult times. So it's not about not having difficult times, but building up our skills and strengths to deal with difficult times. And how do we do that? I mean, how do we build up our strengths or skills to deal with those difficult times? How do we build up that resilience in the same manner as we build up our physical strengths through exercise, diet, etc.? Here are some things that we can do. So first thing is it's very important that we understand that we can't control everything. So there is no point in stressing or worrying about things which are not within our control, because that is an unnecessary burden on us. We have to focus on things that we can control and try to make changes within those things. So for example, let's say we have to go from point A to point B. I mean, you're here in Dharamsala, you have to, let's say, go to Delhi to kind of, or Chandigarh, wherever you are doing your education, and you have to leave tomorrow and you find that all the flights are cancelled for some reason or the other. You could sit here and stress about it, that the flights are cancelled, but it's not going to help because you can't make the planes fly. There's nothing that you can do about it. You would rather kind of think to yourself, okay, I can't do anything about the planes not flying, let's not worry about it. Let's try to find another solution where I can manage to get there, maybe by road, or find a friend who can drive me there, etc. Right? So we need to kind of look at what we can control and not stress or worry about things that we can't control. This is an interesting book about why zebras do not get ulcers, and I think, and this is true, zebras do not get stomach ulcers. Everyone knows ulcers? Yeah? Okay, human beings do get ulcers? Human beings get ulcers, and one of the reasons why human beings get ulcers is stress. Zebras never get ulcers. And the difference between human beings and zebras is that zebras do not stress or worry about the thought of tigers or lions, not tigers, they don't have tigers, lions eating them, right? They do not worry that tomorrow if I go to drink water at the water hole, a lion will attack me. They worry about the lion when the lion attacks them, right? So when the lion attacks them, they run away and try to save their lives, but they don't sit today worrying about the lion eating them tomorrow. Now that's the difference between human beings and zebras. We worry about things which have not happened. And that's what gives us ulcers, or that's what gives us stress. So that's the difference, and this is something to think about. So we need to understand that these thoughts increase the risk of stress, which becomes chronic and ultimately can affect our mental health. Thank you.
Thank you very much, Dr. Abhijit.
Okay. Do you want me to stop? Okay. This has never happened to me before. No one has stopped. Okay. Any case, so the other bit is problem focus solving, coping versus emotion focused coping, right? A lot of us do emotion focused coping. When we get stressed, we get very emotional about it. We get angry. We get worked up, and that's how we try to solve our problems. And that does not help. An alternative way of solving problems is problem-focused coping, which is basically, if you have a problem, you identify what the problem is. It has got very clear steps. You identify what the problem is. You look at various different solutions that are there for the problems, any number of solutions. You think about multiple number of solutions. Then for each of those solutions, you think about what are the potential advantages and disadvantages of each one of this solution, and then pick up the one solution which looks the best with the least disadvantages and the most advantages. Implement it, see if it works. If it works, wonderful. If it does not, look for the next solution that you had on your list. This is problem-focused coping. The moment you do emotion-focused coping, you are bound to develop psychological stress. You do problem solving and you focus on coping through problem solving, that reduces the chances. Disregard the not so great words there. I didn't kind of realize that I would be sitting here, sitting amongst all of you from the Tibetan community, Buddhists, and kind of doing this. Disregard the bad word there, but just kind of remember another way of looking at things is when you experience difficulties, there are various ways at looking at it. There are various perspectives at looking at it. So the same person who is hanging from this cliff, who is about to die, is worried in one picture that he or she is going to die, and the other person looks at it in a different perspective, that he's kind of hanging out and having a nice, breezy place to hang out from. It's nice and cool, and that kind of takes away the stress. So the way we look at things can either make it stressful or not stressful. One other thing that we can do is parking the problems. What we do many times is when we have a big problem, we continue engaging with that problem. We continue thinking about that problem all the time, and that can lead to stress. One way of reducing that is not engaging with that problem. You park the thought. You take the thought in your head, you imagine that there's a box in your head. You actually imagine this, okay? This is visualization. You close your eyes, visualize a box in your brain, open that box, take your worry, whatever you're worrying about, put it in the box, close the box, and forget about it. And you can worry about it tomorrow, right? Tomorrow you open the box, take it out, start to see a different way of dealing with it. You might find that the next day might be different, the way you look at it might be different. And so I'm not saying don't deal with the problem. What I'm saying is deal with the problem later. Continuously engaging with the problem does not help. So parking the problem is a very, very useful way of doing things. Very, very important, make time for yourself. Give yourself time and space. We know from evidence that people who spend time with themselves, people who have hobbies, people who do other things, have less likelihood of developing mental health problems. So give time for yourself, give time to take care of yourself. Just as you give time for your physical health, give time for yourself. I don't think I have to tell you much about this. But this is basically a picture of a young woman, and this is what most of us do these days. When we go visiting, the only thing that we do is click pictures, either of things or selfies, which means that we are not focusing on what's happening around us. And that's what mindfulness is all about, right? So I'm probably preaching to the converted when I'm talking to a room of Buddhists when I say you need to be mindful. But I will say it nonetheless, that being mindful, focusing on what's happening around us is extremely important for our mental health. Right? So we need to be taking in what's happening around us. We need to be experiencing the noises, the sounds, the colors, everything that's happening around us, rather than clicking photographs for Instagram or Facebook or whatever social media that you use. And sleep. Sleep is very, very important. Good sleep is extremely important for all of us. If we are deprived of sleep, we are increasing the chances of developing mental health problems. I know as students, many times when you get closer to your examinations, semester ending, writing your dissertations, etc., you tend to kind of not sleep well. But very important to remember that we underestimate sleep. 6 to 8 hours of sleep usually for most people is very, very important, because if you don't do so, it's going to have an impact on your mental health problem. And then if you've done all of this and none of these works, it's very, very important again to have people you can talk to. It's important to have a person you can trust, or more than one person you can trust, whom you can talk to about your problems, if you have problems, because having someone you can talk about your emotional problems does tend to reduce emotional problems. And having done that, if none of that works, it is very important to seek professional help from psychologists, psychiatrists, counselor, anyone. But if you tried all of these things of self-care, where you try to build up your own strengths, you helped yourself, and it does not help, you need to seek help from professionals. And finally, before I finish, I want to kind of equate life and mental health problems and distress and stress that we experience to whitewater river rafting, as you see here. Life is like that. We are going down a river which is flowing very fast, and we are with a lot of other people in our raft. The river is going to vary. I mean, there are going to be kind of very fast rapids in the river. There are going to be shallow bits of it. There are going to be rocks, some of which are the difficult things that we are going to experience in life. What is important is for us to know the route. What are we going to experience along the way, so that we can avoid some of these things? What is important is for us to have people with us on the raft who can help us to negotiate these rapids and the difficult parts going down the river. What's important is to remember that it's okay at times to park your raft at the side of the river, get out of the raft, sit down for some time, relax, reduce your stress, and kind of that helps you. But we also need to remember that at the end of the day, we have to get back on the raft and go down this river that we call life. And being able to have the strength in ourselves and having people around us to help us is the resilience that we talk about when we want to reduce mental health problems or increase our strengths in dealing with the mental health problems. So I just want to start off with one quick point. There are good things and not so good things about technology, right? So all of you know the not so good things about technology. Let's just talk about the good things about technology when it comes to mental health. An example of what we did was helplines. So we used helplines where people could call in and get counseling. And another example is the work that we are doing in the settlements, called a program called Impact T. You can speak to Yangdol about it, a program that we have initiated in three settlements now, where people with mental health problems within the settlements in South India can go to the primary care center, and then through a laptop get a consultation with a psychiatrist who is sitting in somewhere other part of India, who then kind of sees them through a telemedicine portal, prescribes, makes a diagnosis, prescribes medication as required, and the prescription gets printed out from the other end, and they can get the medications. There are various other things that have been done in other parts of the world. So for example, text messaging interventions, which are the very basic end of the spectrum. There are chat bots which are artificial intelligence or machine learning, where anyone with mental health problems can access help. It's counseling, but it's done by artificial intelligence. There's no person sitting on the other end. The computer kind of does the talking with the person, and you're delivering cognitive behavioral therapy or other interventions using chatbots. So there are various different things that have been done with technology pre-pandemic. But when the pandemic happened, we were forced to accelerate some of these because people are not getting access to services. Having said that, I just want to end with a note of caution. We need to remember that technology is not the answer to all the problems that are there with regards to increasing access to care. We still need people like yourselves, like psychologists, who can deliver interventions, because there are limitations to technology. Everyone does not have access to technology. Although we might think that everyone has mobile phones these days, everyone does not have access to data. Sometimes in a single family there might be only one phone, which is usually held by the head of the family, who's usually a man. So the women in the house or the children in the house might not have access to the phone to access therapy. So there are various shortcomings or limitations of technology which we have to keep in mind when we are thinking about solutions using technology. We have to understand that using technology is good. It will help us, but it's not a replacement for human beings. It's not something that will replace all of your psychologists. It's something that will strengthen your hands, but at the end of the day, we need people to do a lot of the work that we are doing within mental health care. Okay, all right, thank you. So it's great interacting with all of you. Good luck with your careers, and I hope you enjoy the next part of the lecture. I have to take your leave now because I'm speaking at another conference using technology. So I have to go back to my hotel room and kind of set that up and have a chat with them. All right. Thank you. It was a great meeting all of you. Thanks.